Hello everyone. In our last video, we covered all about what is diabetes mellitus, its types, symptoms, and signs, how to diagnose it, and some of its complications. Now we are going to talk about the last one of acute complications of diabetes, which is severe low blood sugar. Hypoglycemia happens when your blood sugar level drops below the range that's healthy for you. Severe hypoglycemia is very low blood sugar. It mainly affects people with diabetes who use insulin. Several factors can contribute to this for people with diabetes. Hypoglycemia can develop if things like food, exercise, and diabetes medications are out of balance. There are common situations that can lead to hypoglycemia for people with diabetes include taking too much insulin, the wrong insulin, or injecting it into your muscle instead of in your fat tissue. 2. Not timing insulin and carb intake correctly. For example, waiting too long to eat a meal after taking insulin for the meal. 3. Taking too much or too high of a dose of oral diabetes medications. 4. Being more active than usual. Exercise makes your body needs more glucose than usual to burn. 5. Drinking alcohol without eating. 6. Eating meals later than usual or skipping meals. 7. Not balancing meals by including fat, protein, and fiber. There is something very important we need to know. Is hypoglycemia exclusively for diabetic patients? The answer is no. So what causes hypoglycemia in people without diabetes? There are two main types of non-diabetes-related hypoglycemia: reactive hypoglycemia and fasting hypoglycemia. Reactive hypoglycemia happens when you experience low blood sugar after a meal. It typically occurs about 2 to 4 hours after a meal. Researchers don't yet know the exact cause, but they think it happens due to a sudden spike and then fall in blood sugar after eating certain foods, especially simple carbohydrate foods like white rice, potatoes, white bread, cake, and pastries. Bariatric surgery can also result in reactive hypoglycemia. After certain types of bariatric surgery, such as gastric bypass surgery, your body absorbs sugars very quickly, which stimulates excess insulin production. This can then cause hypoglycemia. Your body usually corrects reactive hypoglycemia on its own, but consuming carbohydrates may help your symptoms go away more quickly. Second type is fasting hypoglycemia. For the majority of people without diabetes, not eating food for a long time doesn't lead to hypoglycemia. This is because your body uses hormones and stored glucose to manage your blood sugar. However, certain conditions and situations can lead to fasting hypoglycemia in people without diabetes, including 1. Excessive alcohol consumption. Alcohol prevents your body from forming new glucose. If you drink excessive amounts of alcohol over several days and don't eat much, your body can run out of stored glucose. This can lead to hypoglycemia because your body can't properly regulate your blood sugar. 2. Critical illness. You can experience hypoglycemia in critical illness states, such as end-stage liver disease, sepsis, starvation, or kidney failure. This is because your body is using stored glucose for energy faster than your body can create new glucose cells from the food you eat. Adrenal gland insufficiency. Adrenal insufficiency causes lower than normal cortisol levels. As cortisol helps regulate your blood sugar by increasing it, having low levels of cortisol can lead to hypoglycemia episodes. Insulinoma. An insulinoma is a rare tumor in your pancreas that produces excess insulin. It leads to hypoglycemia episodes, most commonly in the early morning. Now, what are the signs and symptoms of hypoglycemia? Symptoms of hypoglycemia can start quickly, and they can vary from person to person. One person can also experience different symptoms for each episode. The signs of hypoglycemia are unpleasant, but they provide good warnings that you should take action before your blood sugar drops more. The signs include shaking or trembling, weakness, sweating and chills, extreme hunger, faster heart rate, dizziness or lightheadedness, confusion or trouble concentrating, anxiety or irritability, color draining from your skin, tingling or numbness in your lips, tongue, or cheeks. Signs of severe hypoglycemia include blurred or double vision, slurred speech, clumsiness or difficulty with coordination, being disoriented, seizures, and finally, loss of consciousness. Severe hypoglycemia is life-threatening. It needs immediate medical treatment. In rare cases, severe hypoglycemia that isn't treated can result in a coma and/or death. You can also experience low blood sugar while sleeping, nocturnal hypoglycemia. Symptoms may include restless sleep, sweating through your pajamas or sheets, crying out during sleep, having nightmares, feeling tired, disoriented, or confused after waking up. Understanding when hypoglycemia symptoms appear is crucial for managing diabetes. The glucose level at which symptoms begin varies among individuals with diabetes. In general, symptoms often begin for people with diabetes when their blood glucose is around 70 milligrams per deciliter or lower. If your blood sugar is falling rapidly, you may experience symptoms before this point. Some people with diabetes can have symptoms of hypoglycemia at relatively higher glucose levels. This is because when you have chronic high blood sugar, your body gets used to that as its normal level. It alters the set point at which low blood sugar symptoms become apparent. Some people who have low blood sugar episodes don't have symptoms or don't notice them. Healthcare providers call this hypoglycemia unawareness. People with hypoglycemia unawareness are more likely to have severe episodes and need medical help. Hypoglycemia unawareness can happen in people with diabetes who live with chronically low blood sugar levels. Their body stops having symptoms when low blood sugar occurs. If you have hypoglycemia unawareness, it's important to let your friends and family know so that they know how to help you if you experience a severe low blood sugar episode. You may also benefit from the following: using a continuous glucose monitoring (CGM) device that can alert you when you have hypoglycemia. Prolonged severe hypoglycemia is life-threatening and can lead to the following complications: multiple organ failure, cardiac arrhythmias, cardiac arrest, permanent brain damage, coma, and finally death if not treated quickly and properly. The only way to know if you have hypoglycemia is to check your blood sugar with a blood glucose meter, glucometer. Most of these devices use a tiny blood sample from a finger prick with a small needle. It could be a helpful tool in identifying and preventing low blood sugar because you can program it to alert you to low blood sugar. Its alerts can be especially useful during times when it could be dangerous to have a low blood sugar, such as while you're sleeping or driving. So now, how is hypoglycemia treated? You treat mild to moderate hypoglycemia by eating or drinking sugar. The American Diabetes Association recommends the 15-15 rule to treat an episode of mild to moderate hypoglycemia. Eat or drink 15 grams of fast-acting carbs to raise your blood sugar. After 15 minutes, check your blood sugar. If it's still below 70 milligrams per deciliter, have another 15 grams of fast-acting carbs. Repeat until your blood sugar is at least 70 milligrams per deciliter. To know how many carbs you're eating, read food nutrition labels. Some examples of foods that contain about 15 grams of fast-acting carbs include: 1 small piece of fruit, such as half a banana. 4 ounces or half cup of juice or regular soda, not diet. 1 tablespoon of sugar, honey, or syrup. If you have symptoms of hypoglycemia but can't check your blood sugar, use the 15-15 rule until you feel better. In case of severe hypoglycemia, it actually requires different treatment than mild or moderate hypoglycemia. If someone you know is having a hypoglycemia episode and is slurring their speech, disoriented, or unconscious, don't give them food or liquid. They could choke. Severe hypoglycemia episodes require the use of emergency glucagon. This is a synthetic form of glucagon that you can administer as an injection or nasal powder depending on the type. Synthetic glucagon triggers your liver to release stored glucose, which then raises blood sugar. If the glucagon is injectable, inject it into their butt, arm, or thigh, following the instructions in the kit. If the glucagon is a nasal powder, follow the instructions on the package to administer it into their nostril. When the person regains consciousness, usually in 5 to 15 minutes, they may experience nausea and vomiting. If they're lying down, roll them onto their side to prevent choking in case they vomit. So now, can I prevent hypoglycemia? Fortunately, the answer is yes, but how can I prevent low blood sugar? It can be difficult to totally prevent low blood sugar when you have diabetes, but you can adjust your diabetes management plan to try to lower the number of hypoglycemia episodes you experience. It's easiest to do this when you and your healthcare provider understand what causes your blood sugar to drop. Give your healthcare provider as much information as possible about any low blood sugar episodes. Fixing the problem may be as simple as changing the times you take medication, eating, and exercise. Take all your medications exactly as prescribed. Follow your healthcare provider's instructions about food and exercise. Use a continuous glucose monitor or check your blood sugar regularly, including before and after meals, before and after exercise, and before bed. After you've treated a low blood sugar episode, write down the details of the episode. Include details such as the time, what you ate recently, whether you exercised, the symptoms, and your glucose level. Now, after we broke down everything about acute complications of diabetes, let's move to the chronic complications of diabetes. They are many and include 1. Blood vessel complications in diabetes. Atherosclerosis leads to heart attacks and strokes. Atherosclerosis is between 2 and 4 times more common and tends to occur at a younger age in people with diabetes than in people who do not have diabetes. Over time, narrowing of blood vessels can harm the heart, brain, legs, eyes, kidneys, nerves, and skin, resulting in angina, heart failure, strokes, leg cramps during walking, which called claudication, poor vision, chronic kidney disease, damage to nerves, and skin breakdown. People with diabetes often develop bacterial and fungal infections, typically of the skin and mouth. When the levels of glucose in the blood are high, white blood cells cannot effectively fight infections. Any infection that develops tends to be more severe and takes longer to resolve in people with diabetes. Sometimes, an infection is the first sign of diabetes. People with diabetes are also particularly likely to have ulcers and infections of the feet and legs because of poor circulation to the skin. Too often, these wounds heal slowly or not at all. When wounds do not heal, they typically become infected, and this can result in gangrene, which means tissue death and bone infection. Amputation of the foot or part of the leg may be needed. Damage to the blood vessels of the eye can cause loss of vision. Laser surgery can seal the leaking blood vessels of the eye and prevent permanent damage to the retina. Sometimes, other forms of surgery or injectable medications may be used. Therefore, people with diabetes should have yearly eye examinations to check for early signs of damage. It is common for people with diabetes to also have steatotic liver disease. formerly called fatty liver disease, in which abnormal fat deposits collect in the liver. Steatotic liver disease can sometimes progress to more serious liver disease, including cirrhosis. Doctors diagnose liver problems if the results of blood tests that measure how well the liver is functioning or imaging of the liver is abnormal, and they confirm the diagnosis with a liver biopsy. Losing weight, maintaining good control of blood sugar levels, and treating high cholesterol can be helpful. The kidneys can malfunction, resulting in chronic kidney disease that may require dialysis or kidney transplantation. Doctors usually check the urine of people with diabetes for abnormally high levels of protein, which is an early sign of kidney damage. At the earliest sign of kidney complications, people are often given medications that slow the progression of kidney damage. For example, sodium glucose cotransporter 2 inhibitors, angiotensin-converting enzyme inhibitors, or angiotensin II receptor blockers. Damage to nerves can manifest in several ways. If a single nerve malfunctions, an arm or leg may suddenly become weak. If the nerves to the hands, legs, and feet become damaged, sensation may become abnormal, and tingling or burning pain and weakness in the arms and legs may develop. Damage to the nerves of the skin makes repeated injuries more likely because people cannot sense changes in pressure or temperature. Diabetes causes many changes in the body. The following changes in the feet are common and difficult to treat. Damage to the nerves affects sensation to the feet so that pain is not felt. Irritation and other forms of injury may go unnoticed. An injury may wear through the skin before any pain is felt. Changes in sensation alter the way people with diabetes carry weight on their feet, concentrating weight in certain areas so that calluses form. Calluses increase the risk of skin breakdown. Diabetes also can cause poor circulation in the feet, making ulcers more likely to form when the skin is damaged and making the ulcers slower to heal. Because diabetes can affect the body's ability to fight infections, a foot ulcer, once it forms, easily becomes infected. Because of neuropathy, people may not feel discomfort due to the infection until it becomes serious and difficult to treat, leading to gangrene. People with diabetes are more than 30 times more likely to require amputation of a foot or leg than are people without diabetes. Foot care is critical. We are going to talk about it later in this series video. The feet should be protected from injury, and the skin should be kept moist with a good moisturizer. Shoes should fit properly and not cause areas of irritation. Shoes should have appropriate cushioning to spread out the pressure caused by standing. Going barefoot is ill-advised. Regular care from a podiatrist, a doctor specializing in foot care, such as having toenails cut and calluses removed, may also be helpful. Also, sensation and blood flow to the feet should be regularly evaluated by doctors. So now you know, diabetes isn't just about high blood sugar. It can cause sudden problems like low sugar, hypoglycemia, or dangerous conditions like diabetic ketoacidosis. And if it's not well controlled over time, it can slowly harm your eyes, kidneys, nerves, heart, and more. But here's the good news. Most of these complications can be delayed or even prevented with the right care, regular checkups, and smart lifestyle choices. So take control, not just of your sugar, but of your health. Your future self will thank you. If you found this helpful, give it a like, and don't forget to subscribe, because in the next video, we'll show you simple steps to protect your body from these complications. See you there.